We will be talking about the Cavum Septum Pellucidum, which is an integral part of the anomaly scan in the brain section whenever we are scanning the brain in 18 to 20 weeks anomaly scan. We usually see it at the transthalamic section of the brain. This is the typical Cavum Septum Pellucidum, which has a rectangle or a rhomboid kind of a shape. As you can see, as a clear space, there is nothing in between, and this is a clear space with the rectangle shape. That is the normal appearance of a Cavum Septum Pellucidum. To make it more objective, there are length to width ratios which are described in the literature. This is the length of the Cavum Septum Pellucidum, and this is the width. Easy to remember is that the length of the corpus, the Cavum Septum Pellucidum, is double that of the width. Later on, we will see what are the implications of it, especially in the partial agenesis. One must remember how to differentiate it from the fornix. So this is the fornix, where you see that it is not a clear space, though you see these two bright lines very well, but you see one more bright line in between, and that is the fornix, whereas the corpus callosum, if you see here, will be seen as one clear space, as you can see here. So whenever you are taking the section, fornix actually is the structure little caudal to the cavum septum and the corpus callosum. So if your section passes through like this, you will see the CSP. But if you are slightly inferior and it goes through the fornix, then you will not see as a clear space of cavum septum, but you will see as two echogenic lines, and then in between there is one more echogenic line. Then you know that you are actually scanning at the fornix and not at the corpus callosum. Of course, the 3D section helps to know the cavum septum, corpus callosum and midline echo complex together like this. So whenever there is a absent cavum septum pellucidum or agenesis of corpus callosum, you will not see that complex very well. As you can see here, this is the cavum septum pellucidum. Inside this faint line at a shadow, what you see actually will be the corpus callosum, and this is the midline echo of the facts, what you see. So this entire complex is called the CCCSP midline echo complex. So that is the normal structure, and this is in a case of agenesis of corpus callosum whenever there was the absent CSP. This is another case where you see this, though this appears as a CSP, you immediately know that this shape is not normal, because we saw that the overall shape is rectangle. Its length has to be double than its width, but as you can see here, the length is small, it has become shorter and it has become wider, and that's why in PACC, that is partial agenesis of corpus callosum, the ratio is less than 1.5. We saw the normal ratio is actually 2 and always it is more than 1.5, but in partial agenesis of corpus callosum, even though you feel the CSP is seen, the shape is abnormal and the ratio is less than 1.5. As you can see here, there is a continuous cavity and there is a absent cavum septum pellucidum, but then the corpus callosum is present. So mind you, the absent cavum septum pellucidum does not always mean that there is a corpus callosum which is absent. You have to search for the corpus callosum. So absent CSP indicates agenesis of corpus callosum. Holoprosencephaly, it is seen in septo-optic dysplasia. If you see this case of ours, this actually was the septo-optic dysplasia. There can be sometimes isolated agenesis of the septum pellucidum, which in fact has a very good prognosis. So one must remember the absence of CSP is not synonymous to ACC, agenesis of corpus callosum. Holoprosencephaly is easier to diagnose, but whenever you don't see CSP and you have the doubt that if there is absent the agenesis of corpus callosum, it just means that you have to make active efforts. You have to take some other sections to look for a corpus callosum, to look for any other abnormalities like septo-optic dysplasia, but do not label all absence of CSPs as ACC.